Good afternoon, everyone. I'm sure you were expecting to see Dr. Lay. She was supposed to be moderating, but she hasn't joined us yet. So I'm going to be introducing our speaker for today. Anna van Osch is a registered dietitian at Sunnybrook. She obtained her Bachelor's of Applied Science from Ryerson University before completing her dietetic internship at Sunnybrook. Anna has been working at Sunnybrook in general surgery and the burns ICU since 2018. Anna works with patients while they're admitted to the hospital to optimize their nutrition and teach them how to eat well after surgery. Without further ado, you're not going to see me anymore. I'll be in the background. If you have any questions, you could put them in the polls or questions. I'm going to pass it over to Anna. Thank you so much, Anna.
Perfect. Thanks for the introduction. So I'm just going to share my screen here. Rico, can you let me know if people can see my screen?
Yep, perfect.
Perfect. Okay. So hi, everyone, and thank you to the Canadian Neuroendocrine Tumor Society for having me today. My name is Anna, and I'm a registered dietitian at Sunnybrook. I work with Dr. Haley in the surgical oncology program. While I usually only see people for a few days or maybe a couple weeks during their hospital admission, I know that each of your experiences with neuroendocrine tumors started long before you were admitted to hospital and will continue after you're discharged home. My role as a dietitian is to sort the scientific research about nutrition from all the other noise on the internet, then translate it into practical advice people can follow at home. While all the information today may not specifically apply to you, I hope to give you some food for thought that you can bring back to your regular dietitian. Or maybe this will encourage some of you to speak to a dietitian for the first time. This slide shows the pillars of cancer care. Food and nutrition are not a cure for NET, but I want to emphasize the importance of quality nutrition to support you through these other treatments. Food can help you maintain optimal health, fight your disease better, and improve your quality of life. While there's no NET diet per se, understanding the role of nutrition and making adjustments to how you're already eating can help you accomplish the above goals. Today, we're going to look at what good nutrition means at different stages of your cancer journey and see how your nutrition goals may vary depending on what stage of treatment you're at. I'll also answer some frequently asked questions that were submitted prior to the presentation, while leaving lots of time at the end to answer any other questions that may come up. Feel free to submit questions as you think of them during the presentation. The American Institute of Cancer Research champions research that increases understanding of the relationship between nutrition, lifestyle, and cancer. These 10 recommendations are guidelines everyone can follow to lower their risk of developing cancer or a cancer recurrence. While it may not always be possible to follow all of these recommendations, it's important to choose to do what you can when you can. I've highlighted a few of the key nutrition messages that will be reiterated throughout the presentation. Eat lots of fruits and veggies, limit processed and red meat, limit fast foods or ultra-processed foods, and limit sugar-sweetened beverages. Do not take supplements for cancer prevention. Nutrients are best absorbed nutrients are best used by the body when they come from the foods you eat. Importantly, make sure to tell your doctor about all the vitamins, minerals, and supplements you're taking, especially during active treatment, as they have the potential to interfere with therapy. We'll discuss which vitamins and supplements may be recommended for you later on. Finally, continue to follow these recommendations during and after treatment. So what does a healthy diet during cancer treatment look like? At the most basic level, it means getting enough calories and protein to effectively fight your disease and feel well. Calories are a way to measure the amount of energy your body gets from food. Carbohydrate, protein, and fat all provide us with calories. Your calorie goals may change during pre-treatment, treatment, and in remission. Maintaining the same weight is a good indicator that your body is getting enough energy. Weight loss, fatigue, or feeling like you don't have enough energy to do what you want during a day are signs that you may be not getting enough calories. You may need to eat more calories during active treatments like chemotherapy, radiation therapy, or after surgery because of the extra stress these treatments put on your body. Choosing high-calorie, nutrient-dense foods like nuts, seeds, dried fruit, full-fat dairy, and healthy oils can help you gain weight. Alternatively, some medications may lead you to gain weight. In this case, you're going to want to choose high nutrient but lower calorie foods that keep you feeling full longer to help limit weight gain. High fiber foods like vegetables, fresh fruit, and whole grains will keep you feeling full longer while still providing you with lots of nutrients. So when you eat any type of carbohydrate, this includes grains, fruits, milk, and sweets, our body breaks it down into glucose, or simple sugar that circulates in the blood. All cells in the body, including cancer cells, need energy to grow. This blood sugar, or glucose, is the main source of energy. Eating sugar or carbohydrates will not make your cancer cells grow faster. Carbohydrate is important for the normal functioning of our bodies and should be included in each meal. There is some evidence that ketogenic diets, which are very high in fat and low in carbohydrates, may be helpful with managing certain types of cancer, including specific types of brain and head and neck cancer. But there's no evidence to support the use of ketogenic diets in managing neuroendocrine tumors. No major cancer organization recommends the use of the ketogenic diet because there's just not enough evidence to demonstrate its benefit for patients or to support its safety. In fact, avoiding carbohydrates to starve cancer cells can actually be harmful to the body. Your body will start to break down muscle for energy if you're not eating enough food by mouth. And also you can miss out on entire groups of vitamins and minerals that are found primarily in carbohydrates. Most importantly, if you're considering starting a new diet, always speak to a dietitian, as they can advise you on the risks and benefits and how to implement your diet in the healthiest way possible. So besides providing energy, protein helps repair damaged tissues and cells, as well as maintain our immune function. Dietitians use formulas to estimate how much protein a person needs. A healthy adult or cancer patient in remission with a stable weight should eat enough protein to maintain their muscles. This is about 0.8 to 1.0 grams per kilogram a day. So for a 70 kilogram person, which is the equivalent of 154 pounds, this means you need 56 to 70 grams a day of protein. However, you may need more protein if you've lost weight or notice that your underarms, legs, or shoulders look thinner than usual, as this can be a sign of muscle loss. Undergoing cancer treatment or surgery can damage your cells and require additional protein to help repair them. For these people, 1.2 to 1.5 grams per kilogram of protein may be required. So for that same 70 kilogram person, it would be 84 to 105 grams a day. Food is rarely 100% protein. Reading product labels, or tables like these that can be found on the internet, can help you figure out how much protein you're actually getting from food. However, an easy way to start is aiming to have one high protein food like meat, nuts, dairy, lentil, or soy at each meal or snack. Amino acids are the smallest building blocks that come together to make protein. Tryptophan is an essential amino acid, which means that our bodies cannot make tryptophan, so we have to get tryptophan from food that already contains it. Tryptophan is important because it's used to build proteins and make the vitamin called niacin or vitamin B3. People with carcinoid tumors tend to have low levels of tryptophan because the tryptophan you're eating is being diverted to the tumor to produce serotonin and potentially creating a niacin deficiency. As a result, these people require a diet high in protein and niacin. This means eating protein foods and whole grains at each meal. If you have weight loss, flushing, poor appetite, or elevated serotonin levels, your doctor may prescribe a niacin supplement in addition to making these diet changes. While high serotonin levels can cause carcinoid symptoms, eating foods that contain serotonin will not cause your tumor to grow. You may be asked to avoid serotonin-containing foods during a 24-hour urine collection for a 5-HIAA test, as it could affect how the results of your test are interpreted. Otherwise, it's okay to eat serotonin-containing foods. So the water found in fluids allows our organs to function properly. Becoming dehydrated not only makes you feel unwell, but if you're constantly dehydrated, this can be harmful. Dark or foul-smelling urine, feeling dizzy, or muscle cramps are signs that you may be getting dehydrated and should sip more fluids throughout the day. Fluids can help you achieve your goals of eating more or less calories. People trying to gain weight should choose fluids that contain calories and protein, like milk, soy milk, smoothies, or nutrition supplements such as Boost and Ensure. While people trying to lose weight should hydrate mostly with fluids that do not contain calories, like water. So people beforehand were also asking about vitamin C. Vitamin C gets a lot of attention in the cancer world because it's an antioxidant. At the cellular level, antioxidants disarm free radicals so they can't do damage to healthy cells. Vitamin C is naturally found in high amounts in many fruits and vegetables. For years, researchers have tried to remove single nutrients from foods to study the individual effect on cancer. Vitamin C is no different. Overall, the research on vitamin C taken as a supplement to prevent cancer growth is very disappointing. However, many large studies of big groups of people, known as epidemiological studies, show overwhelmingly people that have diets high in fruits, vegetables, and whole grains have a lower incidence of cancer. What this tells us is that while vitamin C on its own may not be powerful at reducing cancer risk, when consumed in foods that contain other vitamins, minerals, and phytochemicals, together these micronutrients have a protective effect. So save the money that you would have spent on vitamin C supplements and enjoy some fresh fruits and veggies this summer. It may be hard to picture what these recommendations actually look like. The plate model from Canada's Food Guide is an excellent example of how calories, protein, fluid, and the American Institute for Cancer Research recommendations can come together into one meal. I like the plate model because it guides you on how to build a balanced meal, but allows you to pick different foods that you prefer. Each meal should be made up of half fruits and veggies, a quarter whole grains, and a quarter protein. What you put in each of these sections of the plate is completely up to you, but try to include variety. The plate model promotes weight maintenance. So for those people who are trying to gain weight, you can make modifications to this model, like using healthy oils as a salad dressing or to cook vegetables and grains. If you fill up quickly, choose to eat the protein portion of your plate first, and drink high-calorie, high-protein fluids like milk, milk alternatives, smoothies, and nutrition supplements instead of water. On the flip side, for those people that are trying to lose some weight, your fruits and veggies, eat them raw in a salad, steamed or boiled. Avoid frying or marinated veggies in oil that will add extra calories. Choose lean protein sources like chicken breast with the skin removed, fish, tofu, lentils, and legumes, and try to steam, boil, or braise them without any added fat. You should avoid frying foods or cooking foods in a way that adds a lot of extra fat. Choose high-fiber whole grains that will keep you feeling full longer. And try to have water or calorie-free drinks with your meal. Micronutrients are vitamins, minerals, phytochemicals, and trace elements that are too small for us to see, but play a very important role in cell function, and they're spread out in small amounts in all the different foods that we eat. Unlike carbohydrates and protein or fat, it's very difficult to eat more or less of a specific micronutrient. Therefore, eating a wide variety of foods is the best way to ensure that you get enough of each micronutrient. Taking a multivitamin daily can act as an insurance policy to help you meet micronutrient recommendations on days when eating is difficult. But once again, it's best to get your nutrients from food. Next, I'm going to briefly discuss carcinoid syndrome. This information is only relevant to people with carcinoid tumors that have active symptoms. If you do not have symptoms, then you don't need to follow these diet recommendations. Carcinoid syndrome is a group of symptoms that can happen when NETs make large amounts of hormones. Common symptoms are flushing, diarrhea, gas, bloating, and stomach pain, which can be triggered from emotional stress, physical stress, or food. When it comes to eating, foods high in amines can cause blood vessels to dilate in people with high levels of serotonin and resulting in flushing or diarrhea. Amines naturally occur in many foods. However, they tend to increase as food ripens or ferments. Amines are particularly high in aged, fermented, or spoiled foods and alcohol. Large meals, high-fat meals, spicy foods, and raw tomatoes may also trigger carcinoid symptoms. While these foods may trigger symptoms, they do not cause the tumor to grow. The above foods should only be avoided if they cause symptoms. Otherwise, there's no harm in eating them. The goal of limiting carcinoid symptoms is to improve quality of life. Carcinoid symptoms can be extremely unpleasant, but they're not inherently harmful. By knowing what your trigger foods are, you can take steps to avoid them and hopefully become confident enough to enjoy eating again. Keeping a food diary is a helpful tool to determine what your trigger foods are. Food diaries are most useful when you have a dietitian guiding you, but here's a couple points to get you started. Get a notebook that will be your dedicated food diary. Don't put anything else in this book. Every time you eat, write down what you eat and the time. If you have a symptom like diarrhea, flushing, or gas, record that symptom and the time. Keeping track of how you're feeling and any stressful events is also important. You should also note if you have had any changes in medication. Once it's done, review this diary with your dietitian to see if you can find any patterns between certain foods and symptoms. The more detailed your diary is, the better chance you'll have at finding a pattern. Generally, 2 weeks worth of information is sufficient to start this process. I find keeping a safe food list that you know are foods you tolerate well to be helpful. This way, when you want to try a new food, eat only foods from the safe list, plus that one new food item that day. If you have a reaction, you'll know what it was from. Otherwise, you can add that new food to your safe list. You may also notice that you tolerate small portions of certain foods. However, large amounts cause symptoms. Everyone is different. You'll have to experiment to find out what works for you. So not everyone will require surgery as part of their treatment. However, since I work in a surgical program, I want to briefly review some nutrition considerations for people undergoing surgery. Strong for Surgery is an initiative from the American College of Surgeons to help optimize the health of patients before surgery. Malnourished patients undergoing surgery for gastrointestinal cancers have more than a 10-fold increased morbidity or sickness after surgery. Eating well before surgery and maintaining your weight and muscles gives your body strength, boosts your immune system, and helps you recover after surgery. Signs that you may need to speak with your dietitian include unintentional weight loss, eating less than usual, or any gastrointestinal symptoms like nausea, vomiting, diarrhea, or constipation. Nests can be located in many places, including the lungs, pancreas, ovaries, testes, esophagus, or gastrointestinal tract. I'm going to focus primarily on tumors that affect the gastrointestinal or digestive tract, as these are the ones that are most likely to affect how you eat. If you have a part of your gastrointestinal tract, including stomach, small or large intestine, also known as your bowel, removed with surgery, you may have some issues tolerating certain foods and may be at higher risk for vitamin deficiencies or weight loss. We'll briefly review the functions of different parts of the gastrointestinal tract so you can understand how food is digested and the nutrition problems that may occur depending on what surgery you have. All this is to say that different parts of the gastrointestinal tract are responsible for different parts of food digestion and absorption. So it's important to speak with your doctor and dietitian to understand what diet is recommended based on your surgery. In some cases, surgery will have a very minimal impact on your ability to digest and absorb food, so you may be able to continue eating the same foods that you did before surgery. So digestion begins in the mouth, where we chew our food into very small pieces. The chewed food then travels down our esophagus or throat and into our stomach. The stomach acts as a reservoir or sac where food is mixed with digestive juices and enzymes and is broken down into even smaller pieces. Here, the food waits until it's ready to be released into the small intestine. If you have surgery that removes all of your stomach, it's called a total gastrectomy. But more commonly, you may have part of your stomach removed called a partial gastrectomy, or you may only have a very small part of your stomach removed called a wedge gastrectomy. If you have only a small part of your stomach removed, like a wedge gastrectomy, you may not have to change your diet, since most of your stomach is still there and working properly. However, if you have a lot of your stomach removed, you're more likely to have symptoms like early satiety, which means feeling full quickly, diarrhea, or stomach cramps and bloating. If this is the case, a dietitian can help you change your diet to minimize these symptoms and make eating more comfortable. Next, the partially digested food moves from the stomach to the small intestine, where nutrients like carbohydrate, protein, and vitamins are absorbed through the walls of the intestine and into the bloodstream. Once in the bloodstream, the body uses these nutrients for energy. The small intestine is a very long organ measuring 3 to 5 meters in length, although everyone's a little bit different. Like the stomach, if you only have a small portion of the small intestine removed, also called a small bowel resection, you may not need to change your diet since there's lots of healthy intestine left to absorb the nutrients. However, after any surgery on your gastrointestinal tract, you may experience symptoms like constipation, diarrhea, or poor appetite. These symptoms generally improve over time as the small intestine adapts. After most of the nutrients are absorbed, the digested food moves into the large intestine or colon. In this image, you'll see the large intestine is the thicker looking coil that wraps around the small intestine. This is where the final stage of digestion happens. Here, most of the water that was mixed into the digested food is reabsorbed through the walls of the large intestine and into the body. Reabsorbing the water means poo goes from being runny to a little bit more solid or formed. Diarrhea is common after a large bowel or colon resection because the body isn't as efficient at reabsorbing water. Over time, any remaining large bowel and even the small bowel can get better at reabsorbing water, and the poo should become thicker. As your body does its part to adapt after surgery, there's some changes you can make to your diet to help improve diarrhea. Foods to avoid include simple sugars such as candy, desserts, fruit juices, and sodas. Stimulants like alcohol and caffeine, greasy, fried, or spicy foods, and natural laxatives like prunes, rhubarb, and papaya. Also sugarless gums and candies made with sorbitol. All these foods can cause water to rush into the bowel and make the diarrhea even worse. Instead, eat small, frequent meals, choose non-carbonated, caffeine-free beverages like water, milk, or G2 Gatorade to stay hydrated. And if you're going to drink juice, dilute it with at least equal parts water. Otherwise, it's going to be too sugary. There are many other reasons you may have diarrhea besides a small or large bowel resection. Carcinoid syndrome, medications, chemotherapy, or resection of your stomach can all cause diarrhea. It's important to speak with your healthcare team to understand why you're having diarrhea so the appropriate treatment can be recommended. If you've made changes to your diet and you continue to have diarrhea, speak to your doctor to see if medications may help. In this image, you can see the pancreas hiding behind the stomach. The pancreas releases a hormone called insulin that allows the body to absorb and use the energy released from carbohydrates we eat. Insulin helps keep our blood sugars from going too high or too low. If you have a large portion of your pancreas removed, your body may not be as effective at keeping your blood sugars in a good range. If your doctor is concerned about your blood sugars, they'll test it in hospital after surgery. Otherwise, you don't have to worry about it. If your doctor finds that your blood sugars are too high, they may recommend you speak to a dietitian. Along with medications, dietitians can help you change the way you eat to keep your blood sugars in a normal range. The pancreas also releases enzymes that help digest and absorb fat. If you notice that you have clay or very pale colored poo, or that your poo looks oily and floats in the toilet, this means that your pancreas may not be producing enough enzymes to digest all the fat. If you notice this, speak to your doctor. They may recommend medications to replace these enzymes and to stay away from very fatty or deep-fried meals, as it can be difficult to digest. But like all other surgeries, if enough of your healthy pancreas is left after surgery, you shouldn't need to change the way you eat. So the part of this diagram in gray shows the parts of the pancreas, stomach, small bowel, gallbladder, and bile duct that are removed during a Whipple procedure. This is a big surgery that can result in multiple different symptoms and ultimately weight loss. It's very common for people to lose weight after their surgery, and I would encourage anyone who has a Whipple surgery to speak to a dietitian. A dietitian can help you target the specific symptoms that are making it difficult to eat. Eat enough food to meet your nutrition requirements. Dietitians can also help you track your weight, monitor for signs of dehydration and malabsorption. Eating well in the period after surgery or really during any active treatment can be challenging, as you may have pain, less energy, or gastrointestinal symptoms. Set yourself up for nutrition success by stocking your kitchen with ready-to-eat foods such as frozen entrees, canned foods, and prepared foods from the grocery store before you head to surgery. Cook and freeze meals when you're feeling well, so you don't have to worry about cooking on bad days. Buy nutritious snacks such as cheese and crackers, peanut butter, and trail mix to have at home or to pack as a snack while you're waiting for appointments. Sometimes people find that smaller meals with snacks in between are better tolerated than 3 large meals after surgery. Stay hydrated in the first few days after your discharge from hospital is very important. You should try to drink about 2 liters of fluids per day. Surgery is very stressful and many people may lose weight after surgery. If you lose greater than 10% of your body weight or continue to have weight loss in the weeks after surgery, contact your dietitian or healthcare team for advice. But like your surgery, your diet will be special picked for you to meet your needs. Reach out to a dietitian before surgery, during your hospital stay, or once you've settled back in at home, so they can explain how your diet can work to optimize nutrition and decrease any unpleasant symptoms. With our current knowledge, food cannot be recommended as a treatment for NET. However, it is known that well-nourished people are less likely to develop complications and will be better able to cope with treatment for the disease. In the case of people with carcinoid syndrome, avoiding certain foods that may aggravate symptoms or provoke a carcinoid crisis will surely help improve quality of life. Each one of us can do the following to help optimize our nutrition. Follow the American Institute for Cancer Research recommendations for cancer prevention. Eat enough calories and protein to maintain your weight. Stay hydrated with high or low calorie fluids. Aim to get your vitamins and minerals from foods. And ask how your surgery may affect nutrition. From speaking with many people with NET, I can empathize with the challenges eating presents every day. I encourage every one of you to reach out and start building a relationship with your dietitian. Especially during COVID-19, when many of us feel isolated, we want you to know that we're still here to help you. Whether you need advice about managing symptoms, learning how to eat after surgery, or just want to do a nutrition check-in, dietitians can help you leverage food to live your best life. Thank you all for the privilege of speaking with you today, and I'd be happy to answer any questions.
Hi, I believe Dr. Alay has joined us. I'm just seeing if we do have a couple of questions. Dr. Alay?
Rico, do you want me to stop sharing my screen or just leave it on this slide?
If you can stop sharing your screen or just leave it on that slide, that's cool. I know that Dr. Alay has joined us, and I just sent her a webcam request as well. So she says, Dr. Alay says she's not able to unmute. So I'll ask you a question. Is there any advantage to eating organic foods?
Perfect.
Whenever possible.
Yeah, so this is definitely a question that I get a lot from different people. So what I can tell you is that in Canada, we have a very safe food system. It's highly regulated. So even for products that are non-organic, there's a lot of regulations around how much pesticide can be used on food. So while the general research around, should we or shouldn't we use pesticide is still kind of out, definitely the amount of pesticides that are used on Canadian foods, the levels that you will find on food when it gets to the grocery store are very, very low and are not harmful to people. What I can say too is sometimes price can be a barrier to buying organic food. I know that it can be 2 or 3 times as expensive as the regular product. From that slide that we were talking about, vitamin C and different micronutrients, generally we know the most benefit is really had from eating a variety of foods and fruits and vegetables and including them in your diet every day. So if price is a barrier, definitely do not feel bad about eating conventional or just regular fruits and vegetables. You are definitely getting a huge benefit from that, and the different vitamins, minerals, micronutrients that are in organic versus conventionally farmed fruits and vegetables are really very similar. So the take-home message here should be that just eat fruits and vegetables, and worrying about the organic or non-organic should be a second thought, and really, one that's based off of your personal preference, which you want to eat, not necessarily a health concern, because both types are very healthy for you.
Wonderful. I got a message from Dr. Hale. She said, sorry, my computer does not want to allow access to the mic. So I'll ask you, we got a bunch of questions. So the next one is, how does the gallbladder removal affect digestion or diet?
Yeah, so the primary role of the gallbladder is to release bile that helps us digest fat. However, many people live a very healthy life without their gallbladder because you're still getting lots of other digestive enzymes from different parts, from different organs. So if your gallbladder is removed, you may find it difficult to digest really high fat meals. So things that are like deep fried or really creamy sauces, things like that. So in that case, I would just say avoid those really high fat foods. But otherwise, you should be able to tolerate a regular diet fine. And like with most of my advice, really, it's about symptoms. So it's just if you're having unpleasant symptoms, people tend to self-regulate that way and will just naturally avoid those foods because they don't want to feel, you know, the crummy effects of eating a really high fat meal.
I think Dr. Hale joined us by call. Are you on the call now, Dr. Hale? Oh, maybe not. Okay, I'll just keep going. If you can join, please let us know, Dr. Hale. Is there any research on the benefits of intermittent fasting for NETs?
Right. So I know intermittent fasting has gotten a lot of hype in the last couple of years, mostly around weight loss and some blood glucose control things. There's not, that I'm aware of, a large amount of evidence about intermittent fasting and neuroendocrine tumors. Like I was saying, again, with the vitamin C, my job as a dietitian is to figure out what the high quality scientific evidence is and give that information to you. So that since I'm not aware of any big studies going on, that probably means there's not a lot being done, or the evidence isn't very strong to say that I wouldn't recommend someone to do it for the benefits of managing their neuroendocrine tumor. What I can say too, just thinking about the intermittent fasting, definitely for people who have lost weight or lost muscle mass and are trying to gain it back, I would think pretty hard before starting this diet because it does require like a long period of fasting, which just means that when you're not eating, you know, for 16 hours a day or 18 hours a day, there's less time to eat those calories and protein, and can potentially lead to even more weight loss. So if weight loss has been an issue for you, I would definitely recommend against doing this or doing it with really close monitoring of a dietitian to make sure that you're getting enough calories and protein. Also, again, too, if you're someone who has issues with managing your blood sugars, it's a similar thing of going for long periods of time without having any food. It can also be more difficult to manage your blood sugars. So if intermittent fasting is something that you're interested in, there's not a lot of evidence right now that I'm aware of to support its use in your neuroendocrine tumors. But if it's something that you feel passionate about and want to try, I would definitely recommend speaking with your doctor and your dietitian before starting it so that they can figure out if there's any barriers for you specifically to do it and to make sure that you're doing it in the healthiest way possible.
Great, thank you. Dr. Hale, can you, I see that she's on the phone, but I'm not sure if she can speak.
I'm not sure if this is working right now, but I tried.
It's working.
Okay, fantastic. You were doing a great job, though. I don't think you need me to moderate this really. So we're looking at sort of intermittent fasting. I guess there's a lot of questions, and this is something I hear quite often in clinic about the foods that interfere with urinary 5-HIA test. So would you have like some specific foods that should be avoided during the testing?
Yeah, I wrote down the list because I thought this would maybe come up. So the main trigger foods that we normally think of, would be, oh, sorry, I'm just looking at my slide here. So the common ones are pineapple, pineapple juice, tomatoes, and really any tomato product, plums, eggplants, avocado, kiwis, and nuts, especially walnuts, but really just all nuts. And I know too, if you're going to have this done, usually a dietitian can give you a list of what those foods are before, or Googling just, I think, on the CNET's website, or I might have to send out this afterwards, but there is definitely a list of those high serotonin foods to avoid during that period of when you're getting a test. And it's just kind of for those 24 hours while you're collecting the urine.
Great, thanks. That's very practical and useful. Now, another question was regarding coffee and the need to stay away from caffeinated coffee, or is it better to use decaf for someone with a neuroendocrine tumor?
Yeah, so this again is if you have a carcinoid syndrome, caffeine is a stimulant and it can cause that flushing, diarrhea, those symptoms. So if you're symptomatic, definitely try a caffeine-free version of a coffee or tea. However, if you're not having any symptoms, then there's really no need to avoid the caffeine. It won't cause the tumor to grow or anything like that. It's really just about symptom management.
Yeah, that's really good to know. I think you stressed that a few times during your presentation, that the serotonin-containing food, it's all about symptom control, and there's a high level of individual variation depending on patients, rather than tumor control. So it's not hurting to eat it. It's for like each patient's own comfort with symptoms. So, because I've seen a lot of patients sort of trying, like, restricting a lot of what they're eating, and like this becomes very, very difficult for them when really it shouldn't be.
Yeah, absolutely. And that's what I see too. And I think it's really hard, especially when we're Googling a million things on the internet. And we always caution towards, cutting everything out. And really what that can do, besides making it hard to get enough calories and enough protein to maintain your weight, you're also at risk of, missing out on certain vitamins and minerals that are found specifically in certain types of food. And also, it's just not good for our quality of life. Like, we should enjoy food. Food is about socializing and being around other people, enjoying the taste of it. And all those things nourish us too. So definitely a food diary, and talking to a dietitian is the best way to figure out what your trigger foods are, and hopefully liberalize your diet so you can enjoy eating a more variety of foods.
Great. There's a lot of questions I will sort of summarize into a single one about somatostatin analogs for neuroendocrine tumors, which are, sort of backbone of therapy for the majority of patients, and whether that impacts the absorption of nutrients, or if it can interfere with digestion and gastrointestinal health.
Yeah, this is, I'll be honest, not 100% my area of expertise. I feel like I'd be hoping for a pharmacist to be sitting here beside me to help me fill in on this. So not that I know so much. I don't know, Dr. Halle, if you know a little bit more about this. But really, the main micronutrient deficiency that we're looking for is niacin deficiency that we can supplement. Secondary to that, did you have any more to add on that?
I don't think that there's a lot of evidence or, supporting information on this. There's no real reason why SSAs should impact digestion or impact how nutrients are absorbed. If anything, it's going to help with the niacin deficiency that you talked about, because it stops the transformation of it stops the production of serotonin by the tumor, so that niacin can be used for other purposes that it's actually intended to originally. Yeah. So in that way, I think it actually helps. It also helps control symptoms, and if symptoms are better controlled, then you might be able to eat more food that you wouldn't be eating if you need to control only with diet. and so lead to a more healthy nutrition in that way. In terms of GI health with the SSAs, shortly after the injection, some patients may experience abdominal cramping or diarrhea in the first 2 to 3 days, which is usually self-resolving, and that's the extent to which it's been reported. There's a lot of overlap as well, we have to realize, between being on that medication for a long time and the other treatments that are combined with it, such as surgery or systemic therapy, pills or chemotherapy or whatnot. And sometimes I find that a lot of the changes in GI health are more related to the surgery or the other treatment than the somatostatin analogs themselves. So I hope that sort of answered the question. Bottom line is I don't think it has an impact on nutrition. If anything, it's going to help by providing better control of the tumor, both from tumor size, but also hormonal effects. Now, there is another question about those, dietary supplements or vitamins and what you can take to help with cancer prevention and treatment. What about turmeric? Does that help with neuroendocrine tumor? That's one question. And the other one is cups of green tea, whether they're useful in cancer prevention for recurrence.
Yeah, so a lot of these complementary therapies, there's really not any good scientific evidence to support them, to say that, they stop cancer growth or shrink tumor sizes. Generally, turmeric and green tea aren't necessarily harmful. There are some other products that can interfere with therapies. My approach to these is generally, if you feel like you're getting a benefit from them and they feel like they're helpful to you personally, as long as you tell your surgeon, your doctor, your oncologist about them, and they don't interfere with your therapy, there's really no harm in taking them, but there is no scientific evidence to support that they're helpful. So I definitely wouldn't recommend that people go out and start, having turmeric every single day. But if it's something that you're already doing and you feel like it benefits you, then there shouldn't be a problem in continuing to do it.
Great. And another question, I think that relates to sort of your first slide about recommendation for nutrition and cancer prevention. Why would red meat not be recommended?
So the slides that I was showing were specifically about all types of cancer, but they do, all neuroendocrine tumors do fall into this. The red meat, high amounts of red meat, so that's, not having it 1 or 2 times a week, but having it like every day, has been shown to be linked to an increase in certain types of colon cancer. And especially with that too, it's also processed meat, or like barbecued meats, things like that. Also too, the other benefit of these same recommendations is that a lot of them help with managing different chronic diseases like heart disease, or the development of heart disease or diabetes and things like that. So all these recommendations are really recommendations for good general health plus cancer prevention. So we just know that limiting servings of red meat to a couple times a week is better than having it every single day.
All right, I'm just going through the other questions that we're receiving. One of them was about a different type of neuroendocrine tumors. I know you work was on the surgical service with gastrointestinal patients, so you let me know if this is out of your expertise. Some thyroid neuroendocrine tumors, I think we're speaking specifically about medullary thyroid cancer here, can produce high calcitonin level. Is there any dietary recommendation regarding calcitonin content?
Yeah, again, I don't work with this group very often. So, I mean, normally too, like I would say when there's issues with like the thyroid and manage in this sense, diet can be a starting point, but it doesn't always necessarily fix the entire problem. I don't know, Dr. Hoy, if you know a little bit more than me, just because this isn't a type of tumor I see very often or I'm consulting.
Yeah, I haven't treated thyroid tumors in a while now. I did during training, but to my knowledge, calcitonin is mostly used as a tumor marker for these tumors, and we use it for prognostication, so to see which tumors are more active, less active, etc. And it doesn't really impact whether a tumor grows or whether people will have symptoms. So I wouldn't see any need to reduce calcitonin intake or modify diet around that. But the best thing to do is to speak with your surgeon, your oncologist, or your dietitian, so that they can provide you more specific or tailored recommendation if need be. So maybe we'll go with one final question. I get that very, very often as well in clinic. I'm not always sure what to answer, and I tend to ask for outpatient clinical nutrition consults. So,
absolutely. We're really good at looking stuff up if you just give us a few minutes.
Yeah. So, this last one is, it's one of those where I do refer a lot of patients for that. So what could be a cause for like having significant gas like up to 9 months after surgery? And is there any foods or supplements that may cause those gas?
Yeah, so normally in terms of like gas and bloating, things that we recommend that you have control of. So I always try to focus on what do you as the patient have control of and what things that you can change. After surgery, our bowels, are a little bit different. They may not adapt right away, but things that you can change and you can do is avoiding kind of those carnivorous vegetables like cauliflower, broccoli, cabbage, because they tend to produce a lot of gas, as well as things like beans, lentils, and legumes, because they kind of get fermented in the colon and will also produce more gas. Also doing simple things like avoiding drinking carbonated beverages, because you're just actually introducing even more gas into the system, or even doing things like talking while you're eating or using a straw to sip your fluids. All those things introduce more gas into the system or ferment and produce gas. So trying to avoid those foods are things that you have control of that can hopefully help with those symptoms. Unfortunately, I can't, speculate on the cause of why it's happening, but hopefully those are some tips to help you, feel a little bit more well when you're eating.
That was fantastic. Thank you so much, Anna. I think we're going to close the session now. So thank you for your time answering all those questions, like all types of questions that came our way. And I think overall, I hope everyone realizes the importance of having a registered dietitian as part of your care team. And nutrition is a very important component of supportive care for any patients, but I think specifically also for cancer and neuroendocrine patients. But like everything, we all need a good understanding of what's good and what's not good, so that you don't, as Anna mentioned before, over restrict yourself either, and use nutrition to your advantage and continue having fun eating. So we keep a few fun things in life. And and I hope this was helpful, and don't hesitate to ask for dietitian consultation to your care team. They're everywhere, and always happy to help with patient care. So we'll see you for the next webinar, everyone.
Perfect. Thank you.